Are you expecting your first child soon? You don't have to worry about anything because I'm here to help you. I will tell you everything you need to know about pregnancy at 9 months. From the signs to the baby development, you'll be informed every step of the way. Plus, I'll give you some important advice to make this time of your life as special as possible. Don't miss out on this amazing opportunity to learn more about becoming a mom. Keep watching this video and get ready to become a mom. You're in the final stages of your 3rd trimester at 9 months pregnant and almost ready for the big moment. But when your body gets ready for their entrance, your little bun still has a few weeks to bake. We'll go through what to anticipate from yourself this month, as well as how your unborn child is doing. We'll also go over what to expect at your upcoming doctor visits, and provide you some advice on how to make the most of your last month of pregnancy. 9 months pregnant, signs. You're probably already accustomed to the plethora of symptoms that pregnancy brings. But let's go over them again and emphasize the new ones. Rest easy knowing that the majority of these issues will disappear once the baby is born. Painful physical symptoms. Your belly is the largest it's ever been at 9 months pregnant. You shouldn't be surprised to feel uncomfortable because your tummy puts additional strain on your back. You also feel more achy and sore because your pelvic bones are separating and relaxing in preparation for the birth of your baby. On the plus side, because your baby's head is now in the pelvic region, your lungs and diaphragm can expand, making breathing a little easier. Swelling. Your body is retaining water at this stage of pregnancy, so you may have some swelling, especially in your legs, ankles, and feet. It's an excellent excuse to ease up this month and spend more time relaxing. Due to the compression of the median nerve and enlargement of the nerve surrounding the wrist, some pregnant women also begin to experience tingling or numbness in the fingers, wrists, and hands. This condition, known as carpal tunnel syndrome, is typical of this stage of pregnancy. Frequently using the bathroom. This month, when the uterus presses against your bladder, you'll make more trips to the restroom. You can also have some constipation, as the walls of your vagina and cervix soften. Another thing you could notice is an increase in vaginal discharge. Skin alterations. On certain areas of your body, such as your areola and linea nigra or pregnancy line, you might detect hyperpigmentation or darker skin. Melasma is a condition that causes darker, blotchy regions of skin, typically on the face. You might also notice stretch marks on your breasts, upper thighs, or stomach. Tiny rips in the skin's underlying layers cause stretch marks. These may result from inheritance, a particular lifestyle choice, or the amount of weight accumulated during pregnancy. Stretch marks can be treated with some products, such as our skin-nourishing stretch marks cream, serum, and oil. These can aid in preventing stretch marks from developing during pregnancy by hydrating and soothing the skin. Varicose veins are the final skin condition you could experience at 9 months pregnant. These develop when the vena cava is compressed by the uterus, reducing blood flow. The good news is that once your baby is born, these should go. Lack of sleep and fatigue. This month, you can experience weariness and insomnia as a result of your infant living with you. Your extra weight makes even your everyday tasks difficult. When night falls, it becomes more difficult to find a comfortable sleeping position because of your tummy. A breast leak. A breast leak. Your breasts may begin to produce milk before your due date, as they prepare for the birth of your child. The first thing your infant eats is colostrum, a yellow fluid that typically leaks from your breasts. This is typical, but if you see more than a few drops, blood, or unusual nipple discharge, consult your doctor. Braxton Hicks. It's typical to experience more Braxton Hicks contractions, sometimes known as practice contractions, at 9 months pregnant. However, they do not signify that you are in labor. Braxton Hicks are your body's method of preparing for birth. With exercise or exertion, these typically disappear. Nesting in emotions. You're cleaning, organizing, and getting ready for the baby with a surge of enthusiasm. We refer to this as nesting. It's common to experience an intense desire to prepare your home for your new family member throughout the 9th month of pregnancy. Mood changes. Your emotions may seem to be all over the place as you turn the final bend of your pregnancy. Given your lack of sleep, physical stress, and fluctuations in your hormone levels, this is not unusual. Forgetfulness. The fact that you're feeling a little forgetful this month is also not surprising given everything on your mind. Don't be too hard on yourself if you have pregnancy brain, as it could be caused by hormones. Pregnancy at 9 months, your baby. 36 to 40 weeks are equivalent to 9 months of pregnancy. It should come as no surprise that the 9th month is all about making the last preparations, as your baby is regarded as full term at 39 weeks. Development, the muscles, bones, brain, and lungs. Your pregnancy is almost over, and your baby's brain and lungs are almost fully formed. While your child's skull will remain flexible to pass through the birth canal, their bones will also stiffen this month. By the middle of the month, their muscles will be strong and prepared. Nails and hair. The baby's lanugo, which covered its body in fine, soft hair, while it was a fetus, is now gone, and they may even have a full head of hair. Additionally, their nails are spreading all the way to the tips of their fingers. Coordination. Your infant is developing good coordination these days. They possess the ability to turn their heads, blink their eyes, and grab objects. Additionally, they react to touch, sound, and light. Now is a fantastic time, if you haven't already, to talk to them and tell them stories so they can become acclimated to hearing your voice. Position. This month, your baby will establish their final position for delivery by dropping down in your pelvis. If not, don't worry, they should be facing down toward the delivery canal. Size. By month 9, your child is roughly the size of a pineapple, weighing 6 to 9 pounds and being 18 to 20 inches long. 9 months pregnant, medical appointments. You will now receive prenatal care on a weekly basis. Blood pressure, weight, and fundal height. The distance between your pubic bone and the top of your uterus will all be checked by your doctor. In addition to checking on your baby's position and the fetal heartbeat, your doctor will also keep an eye on both. They might offer a C-section or suggest strategies to flip your baby if they are breech. In order to determine how soon the baby will be born, your doctor will also examine your cervix for dilation and perform a Group B streptococcus test on you. If you test positive, they will likely advise taking antibiotics. Advice for succeeding at 9 months pregnant. Keep your sights set on the finish line as the 3rd trimester draws to a close. Staying active will give you more energy, enhance your sleep, and lift your mood, whether you're walking or doing easy yoga. On the other hand, if you have trouble falling asleep at night, you should be sure to obtain adequate rest during the day. You might want to do the following this month. Visitem medical asili. It's advisabletobocom. Thelication befavab. Kiso si pediatrofenton efis. Final is your birdalafifanti. Eta hospitalbagri. Preparathenerzi. Instalthacarcete. Stockthedia periontins. Selecthababis foetus. And organizelafli bulabi. Butabavial. Enjoyer ninthan torrenti. Placeomemus forfant. Share a book with them. Giveth emergentliu. And be patient. You new concentran torrent. The newborn is Alistair. Get set. Go. You wereno preparagation ephizan. To get throdisters free as possible. Consideral thephiphilus. And emotion alkagriosi. As well as what I aldwarduk. Also, keep in mind theshephalafil. Consider mustalaskin sotothingali huntor. When your child is burn. On scorganic nurstantant. Thank you for watching my video. Subscribe to see more content like this one.